Hey there, Brainiac. So glad you're here. Big ups for turning this study time into a power move. Whether you're busy, on the go, let's jump into today's questions and help you crush your day. Question 1. Mucorrhizopus causes an infection called mucormycosis, particularly in patients with what condition? Diabetic patients with ketoacidosis. Question 2. Malassezia furfur is known for causing which common skin condition? Tinea versicolor. Question 3. Which group of fungi are the most common cause of fungal infections of the skin, hair, and nails in humans? Dermatophytes. Question 4. What is the primary difference between the yeast form and mold form of fungi? Yeast at body temperature in tissue, mold at room temperature in culture. Question 5. Which fungus is endemic to the southwestern region of US and causes fever, dry cough, pleuritic chest pain, and profound fatigue, followed by erythema nodosum? Coccidioides immitis. Question 6. Blastomyces dermatitis primarily causes disease through which route of infection? Inhalation of spores from soil and wood dust, usually from decaying vegetation. Question 7. An agricultural worker from rural Brazil presents with chronic cough, weight loss, and painful oral mucosal ulcers. Biopsy shows multiple narrow-based budding yeast in a radial pilot wheel pattern. Paracoccidioides brasiliensis. Question 8. Which fungus causes a chronic pulmonary infection that can resemble tuberculosis in endemic areas such as Ohio and Mississippi? Histoplasma capsulatum. Question 9. Sporotrichosis is acquired through what type of injury? Through a rose thorn prick. Question 10. Pneumocystis jirovecii is known for causing pneumonia in which population of immunocompromised patients? Patients with HIV, especially those with CD4 count less than 200 cells per microliter. Question 11. A gardener presents with a nodular lymphocutaneous lesion following a thorn prick. Which of the following best describes the pattern of spread of this infection? Spread along lymphatic drainage. Question 12. A severely immunocompromised patient with multiple fungal infections is treated with amphotericin B. What is the mechanism of action of this antifungal drug? Binds to ergosterol in fungal cell membranes, causing cell lysis. Question 13. A patient with diabetic ketoacidosis develops rapid facial swelling and necrotic lesions. What is the urgent diagnosis? Mucormycosis, often rhinocerebral. Question 14. What is the characteristic appearance of tinea versicolor caused by Malassezia furfur? Hyper or hypopigmented macules on the chest and trunk. Question 15. A 25-year-old patient presents with a scaly, itchy rash on the groin area that spreads in a circular pattern. Which organism is most likely responsible? Trichophyton species. Question 16. A patient from the Mississippi River Valley presents with a progressive pulmonary infection and skin lesions. Which organism should be suspected? Blastomyces dermatitis. Question 17. Candida albicans is known to cause which condition in healthy individuals with normal immunity? Oral thrush and vaginal yeast infections. Question 18. What key feature of Cryptococcus neoformans allows it to evade the immune system, and how is it detected in the laboratory? Polysaccharide capsule, detected with India ink stain. Question 19. What is the classic presentation of pneumocystis jirovecii pneumonia? progressive dyspnea, non-productive cough, fever, often in immunocompromised patients. Question 20. A patient from Ohio with a chronic cough, hemoptysis, and pulmonary cavitations is suspected of having histoplasmosis. What is the route of transmission of Histoplasma capsulatum? Inhalation from soil, contaminated with bird or bat droppings. Question 21. A patient with AIDS presents with fever, productive cough, and a ground glass appearance on chest X-ray. Which organism is most likely? Pneumocystis jirovecii. Question 22. Which fungus causes meningitis in immunocompromised patients and forms a gelatinous CSF with positive India ink stain? Cryptococcus neoformans. Question 23. Which fungus shows broad, non-septate hyphae with angioinvasion and tissue necrosis? Mucorrhizopus. Question 24. A patient from Brazil presents with granulomatous disease affecting the lungs, skin, and mucous membranes. Which fungus is most likely? Paracoccidioides brasiliensis. Question 25. A hospitalized patient on prolonged antibiotics develops a white patch on the tongue that cannot be scraped off easily. What is the likely cause? Candida albicans. Question 26. Which characteristic distinguishes dermatophytes from other fungi in terms of their ability to invade tissue? Production of keratinolytic enzymes.